For this video, we're going to be doing oral medication. I'm only going to be showing you how to do the liquid medication. For this, you're going to need to know your right medication, right dose, right patient, right route, right time, and right documentation. Your supplies that you're going to need is your MAR, your pill crusher, pill cutter, spoon, applesauce, paper towel, 8 ounces in a water cup, 2 souffle cups, your graduated medication cup, and an oral medication syringe. When dealing with cutting medications, you cannot crush a sustained release medication and enteric-coated long tablet, a long-acting tablet, and a sublingual tablet. You cannot crush those. When they are for high alert drugs that you need to be aware of, that's your antiarrhythmic, anticoagulants, insulins, and antihypertensives. You need to be aware of those. When you're dealing with Lanoxin, you need to count the applicable pulse for 1 minute, 1 full minute, and you need to hold the medication if it is less than 60 beats per minute, because you don't want to cause any harm to the patient. You need to verify that with another physician, because it can be dangerous for our patient. You need to go and make sure that the patient, you need to know, can they swallow? You need to check their allergies. You need to know if they are charted for nothing by mouth for labs or any procedures. Make sure everything is good. And your medications, when you're doing medications, you want to check them 3 times. You want to make sure you're checking them when you take them out of the storage. Make sure you're checking them whenever you're preparing. And after you've prepared, you also want to check them when you're putting them back. Make sure they're in date and not expired. You also want to make sure there's nothing wrong with them. There's anything abnormal with them. But for this scenario, we were given guaifenesin 150 milligrams by mouth as needed for cough. Our label says that it is 100 milligrams per 5 milliliters. And I'm going to go ahead and do that calculation. We're going to do 150 milligrams. 5 milliliters over 100 milligrams. Okay, type that in. 150 times 5 divided by 100. 7.5 milliliters. Okay, and this is my calculation. Alright, what we're going to do, first we're going to start off with our liquid medication. This is what I'm using for my guaifenesin. What we're going to do with this, you're always going to make sure you check your label, make sure you can read it and there's nothing spilled on it. Because if you can't read it, you need to call and get it verified and make sure it's the right medication before you give it out. Whenever you're given the medication, you always want to hold it with the label in the palm, like this, in your dominant hand. You want to unscrew the top, place it right side up, get your medicine cup, find 7.5. You want to be eye level. Make sure you're not touching your bottle to your medicine cup. Let's see, 7.5 milliliters. You never want to touch. Don't let it touch. Okay, that's right. Alright, what we're going to do, and if you ever get too much, you can just pour it back in there. Do not let it touch the bottle, of course. And before you're doing all this, you're also going to make sure that you have hand hygiene, that you're checking everything before you do. You want to make sure that you are preparing it correctly in the right order. I should have said that earlier. Hand hygiene. That's a major part. Okay. You're going to go give this to your patient. You're going to set them up in the Fowler's position. You're going to give them the medication and give them 8 ounces of water afterwards. After you finish that, you're going to document. You're going to perform hand hygiene and put them in a comfortable position. After 30 minutes, you're going to come back. You're going to check the effectiveness after giving the medication. Make sure there's no problems or anything that could be going on with your patient, and make sure that they are not allergic to it. I'm also going to move this out of the way so I don't make a mess. Okay, when you're dealing with your crushing your tablets, I've already mentioned which ones you can't crush, but you're going to make sure that you have your medicine bottle. I wish I had a medicine bottle with me, but you have your medicine bottle. You're going to take the cap off, and whatever is ordered, you're going to tap it till you get however many you need. If you get too much, just tap it back. Never touch the medication with your hands. Once you get it in your little cap, you're going to put it in a souffle cup, put another souffle cup on top of that, and put it in your crusher. You're going to crush it till it's good. You're going to get your medication cup, put your applesauce in it. You're going to make sure it's good. You're going to pour your crushed medication in there. If it's not crushed all the way, you can just tap it with a spoon, get it all crushed up, good mixed around, stir it up. When you go to take it to your patient, you're going to make sure that you get as much as you can in one spoonful, because they may not let you give it to them again. So you're going to give it to them, also at that position, and you're going to also give them 8 ounces of water afterwards. And repeat the same steps afterwards as far as documenting and hand hygiene and checking the effectiveness. When you're dealing with cutting your pills, you're going to make sure that you put the pill in the cutter. Make sure it's lined up with the blade. Cut it. The one you don't use, you're going to discard it. Where by the facility's policies, wherever they want you to do with it, that's what you're going to do with it. And you're going to put it in a little cup, and you're going to take it to them. As far as cleaning everything, you're going to make sure before you use these cutters and crushers, you're going to make sure they're clean with alcohol prep. Make sure you're cleaning the blade very good. You don't want to give any leftover medications to your patient because it could be harmful. It can cause them to have more issues than what they already have and longer stay in the hospital. You're going to make sure that you are documenting everything and initialing it, time, patient, and everything regarding what you've done, checking the effectiveness, documenting how they're doing, document everything, and always get another nurse to check your calculations, always. With that being said, always wash your hands, always put on gloves, and that should be it.